Marcus. I want to take a few minutes of your time to talk about a critical care presentation that you may see in your practice, hyperthyroidism, and also thyroid storm. And we want to talk in general about the thyroid. We understand it's part of the endocrine system and it regulates the metabolic rate of the body. How do these patients present? They consider this, by the way, an autoimmune disorder, and it's usually referred to as Graves' disease. How do they present? They have probably aches and body aches, insomnia, GI problems, fine hair. Remember, the metabolism is not normal. Problems with their menstruation, weight loss, hyperactivity, and something that we can pick up is a goiter. A goiter, and you can check by asking the patient to swallow and palpate front or back, and it sticks out, and it's actually an enlargement of the thyroid itself. And you can, people actually sometimes live with them because the surgery, which we'll go over in another video, is not so simple. We'll talk about thyroidectomy another time. What do we do for these patients? One thing they have visually, besides the goiter, is the large enlarged eyes. That's called exophthalmos, and they also have changes in their skin. We need to check for jaundice and GI problems that they can also get. So obviously this affects so many parts of the body. It's a radical presentation. They also have changes in their cardiac system, widening pulse pressure. And the pulse pressure, remember, is the difference between the systolic, which is the contraction of the heart, and the diastolic, which is the relaxation when the heart fills. So that widening pulse pressure is not good. Some of the nursing interventions that we do for these patients, we need to check their labs, TSH, T3, T4, okay? And then we also give them medications such as Tapazole, PTU, and also propanadol or Inderal is used. That's a beta blocker, and that's to help them with the hyper blood pressure, heart rate, and EKG changes. Sometimes we do orthostatic changes with these patients also. Sometimes we give them iodine solutions, and one of them is Lugos, L-O-G-Os. And when they give the Lugo solution, they caution that the iodine that's given with it needs to be used with a straw. This is mentioned in ATI. Also to take it with milk or juice to mask that taste. And other things that they mention, if they are going to do radioactive therapy to reduce the size of the thyroid, this goes into a whole new precautions that ATI wants you to know. They're on it for 6 to 8 weeks. You want to avoid children, cannot get pregnant for 6 months, do not use the same toilet for 2 weeks as other family members, and flush 3 times. I've seen this asked many times on ATI. Take a laxative, completely empty the bowel of any radioactive elements in it. Wash clothing separate and clean your toothbrush and use disposable plates. One more radical presentation that's part of this is thyroid storm. This is everything even more. High heart rate, high blood pressure, high respirations, temperature high. They're perspiring, they're confused. We use propranolol, the beta blocker. They are not to have any aspirin, and because it has a binding of protein, and no morphine, believe it or not, because it also has a binding property. You as nurses can see when a patient presents with thyroid problems and they're telling you they're not sleeping, their hair has changed, metabolic change, immediately get labs done, further assess for signs of hyperthyroidism, and caution them on thyroid storm. Thank you for your time.